Hi, Mike. My name's Dr. Joshua Fink. I've got a practice here in Cottleville and then one out in Wentzville. I'm a chiropractor. I've been in practice about 15 years, over 220,000 adjustments. I know a thing or two about chiropractic adjustments. I know a thing or two about chiropractic patients. And I want to talk to you about a segment that you aired the week of February 16th. In that segment, gentleman gets an adjustment on a Friday, I think, and then Wednesday, he was determined to have had a stroke. And the gist of this segment is that the chiropractic adjustment caused the stroke, or could it have caused the stroke? And you bring in a medical expert that says that there is a quote-unquote strong connection through research that chiropractic adjustments cause stroke. Michael, there is absolutely no human evidence or any experiment that's been performed that documents chiropractic adjustments causing stroke, ever. There are numerous small controlled studies that seem to indicate that there's a causation, but they suffer from the same bias, that topics that we are temporality or causation, those things can't necessarily be associated with a chiropractic adjustment. Just because two things happen in the same place doesn't mean that that's what caused it. But your segment seems to ignore that, and your experts seem to ignore that too. What they can't ignore is that in issues of Spine magazine that documented over 800 and something controls, people are no more likely to have a stroke in a chiropractic office as they are in a primary care provider office. And it's not because they're having a stroke because of a procedure. It's because they're showing up to the offices already had the stroke, or the stroke is in progress. Because what are those symptoms? Headache and neck pain. That's why they come here. That's why they go to primary care providers. And they're no more likely to be in either case. When you publish that type of segment with that poorly of a reference and with medical experts who are not well read on this topic, all you do is unnecessarily frighten the public. If you want to do an article on chiropractic, you could do an article that talks about why we have such a high patient satisfaction rating. Or you could do one on our cost effectiveness, how it's almost untouched by the other professions for those things that we treat. I'm sure my medical colleagues would get a kick out of seeing something like that. So I look forward to any questions that you have. You can find me here at the office. Thank you for your time.